NCLEX RN Practice Quiz, Part 4. 31. The 88-year-old client is admitted to the ED with numbness and weakness of the left arm and slurred speech. The computed tomography, CT, scan was negative for bleeding. Which nursing intervention is priority? 1. Prepare to administer tissue plasminogen activator, TPA. 2. Discuss the precipitating factors that caused the symptoms. 3. Determine the exact time the symptoms occurred. 4. Notify the speech pathologist for an emergency consult. 31. Correct answer 3. The nurse must first determine when the symptoms started before administering TPA, a standard of care. TPA must be initiated within 3 hours of the start of symptoms because, after that time, revascularization of necrotic tissue, which occurs with the administration of TPA, increases the risk for cerebral edema and hemorrhage. 32. The nurse is assessing the client experiencing a left-sided cerebrovascular accident, CVA. Which clinical manifestations would the nurse expect the client to exhibit? 1. Hemiparesis of the left arm and apraxia. 2. Paralysis of the right side of the body and aphasia. 3. Inability to recognize and use familiar objects. 4. Impulsive behavior and hostility toward family. 32. Correct answer 2. A left-sided CVA results in right-sided paralysis, right visual field deficit, aphasia, inability to speak, and altered intellectual ability. All other options are results of right-sided CVA. 33. The HCP has discussed a carotid endarterectomy with the client who has experienced 2 transient ischemic attacks, TIAs. The client tells the nurse, "I really don't understand why I need this procedure, and I don't want to have it." Which scientific rationale would support the nurse's response? 1. This surgery is indicated for clients with symptoms of a TIA due to carotid artery stenosis. 2. This surgical procedure will ensure the client does not have a cerebrovascular accident. 3. This surgery will remove all atherosclerotic plaque from the carotid arteries. 4. This surgical procedure will increase the elasticity of the carotid arterial wall. 3. Correct answer 1. This is the rationale the nurse would utilize to encourage the client to have this surgical procedure. An endarterectomy does not ensure the client will not have a CVA, nor does it ensure that all atherosclerotic plaque will be removed or that the carotid artery wall will become more elastic. 34. Which client would the nurse identify as being least at risk for experiencing a CVA? 1. A 55-year-old African American male who is obese. 2. A 73-year-old Japanese female who has essential hypertension. 3. A 67-year-old Caucasian male whose cholesterol level is below 200 mg per deciliter. 4. A 39-year-old female who is taking oral contraceptives. 34. Correct answer 3. Caucasians have a lower risk of CVA than African Americans, Hispanics, and Native Pacific Islanders. A high cholesterol level, being African American, hypertension, and oral contraceptive use are risk factors for developing a CVA. 35. The client diagnosed with a right-sided CVA is admitted to the rehabilitation unit. Which intervention should be included in the nursing care plan? 1. Turn and reposition the client every shift. 2. Place a small pillow under the client's left shoulder. 3. Have the client perform quadriceps exercises 3 times a day. 4. Instruct the client to hold fingers in a fist. 35. Correct answer 2. Placing a small pillow under the left shoulder will prevent the shoulder from adducting toward the chest and developing a contracture. The client should be repositioned at least every 2 hours. Quadricep exercises should be done for 10 minutes at least 5 times a day, and the fingers are positioned so that they are barely flexed. 36. The nurse is planning care for the client experiencing dysphagia secondary to a CVA. Which intervention should be included in the plan of care? 1. Evaluate the client during mealtime. 2. Position the client in a semi-Fowler position. 3. Administer oxygen during meals. 4. Refer the client to a physical therapist. Correct answer 1. Dysphagia, swallowing difficulty, puts the client at risk for aspiration, pneumonia, dehydration, and malnutrition. Therefore, the nurse should evaluate the client during mealtime. The client should be in a high Fowler position or, preferably, in a chair. 37. The nurse and a UAP are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The UAP places the gait belt under the client's axilla prior to ambulating. 2. The UAP places the client on the abdomen with the client's head to the side. 3. The UAP uses a lift sheet when moving the client up in the bed. 4. The UAP praises the client for attempting to perform activities of daily life, ADLs, independently. Correct answer 1. The gait belt should be around the waist because this is the client's center of gravity. All other options are appropriate interventions for the UAP and would not require intervention. 38. The client diagnosed with chronic atrial fibrillation has experienced a transient TIA. Which discharge instruction should the nurse implement? 1. Keep nitroglycerin tablets in a dark-colored bottle. 2. Check the radial pulse prior to all medications. 3. Obtain international normalized ratio, INR, routinely. 4. Take over-the-counter vitamin K tablets daily. 38. Correct answer 3. An oral anticoagulant, warfarin, Coumadin, will be prescribed to help prevent the formation of thrombi in the atrium secondary to atrial fibrillation. The thrombi can become embolic, which may cause a TIA. The INR is the laboratory value used to determine therapeutic oral anticoagulant levels. 39. The client diagnosed with a CVA has hemiparesis. Which problem would be priority for the client? 1. Impaired skin integrity. 2. Fluid volume overload. 3. High risk for aspiration. 4. High risk for injury. Correct answer 4. Hemiparesis is a weakness on one side of the body that may lead to falls. This makes high risk for injury the priority problem for this client. 40. The nurse has received the morning shift report. Which client should the nurse assess first? 1. The client who is complaining of a headache at a 3 on a scale of 1 to 10. 2. The client who has an apical pulse of 56 and a blood pressure of 210 out of 116. 3. The client who is reporting not having a bowel movement in 3 days. 4. The client who is angry because the call light was not answered for 1 hour. 40. Correct answer 2. This blood pressure is extremely high, and the pulse rate is decreased, therefore, this client should be assessed first. A 3 headache, no bowel movement, and an upset client would not be priority over a client who may be having a CVA.